Hi, my name is Sari Hewlett and I'm a physio and have been a physio for the past 28 plus years. And in that time, obviously, have managed a lot of people who have injured themselves, hurt themselves, been a field side physio for a few different teams, but also it doesn't matter where you go, people will say, have you got a minute? What have I done? Can you have a quick look at this? I've injured it. I've done this. No, I don't need to go and check anything. I don't need to see somebody. I just want to know, is it serious? Have I done this? So I have designed this little program called My Pocket Physio, basically aimed at that. Have you injured yourself? Have you thought, it's not that bad, but I think I've done something? Or, would you just want somebody to roll an idea around and go, I don't think it's bad enough to go to hospital. I don't think it's bad enough to make an appointment. I don't want to wait, to get an appointment and then go and see somebody. I just want to know, have I done something serious? Have I hurt myself? Is it something I need to look after? So that's the idea behind My Pocket Physio. It's an injury management program. And basically what it'll have is information for the major conditions that people normally injure themselves with. So if you've got something like a tennis elbow, how to test if it is tennis elbow, what a tennis elbow presents like. It does, where's the pain? So with tennis elbow, you'll get pain on the outside of your arm. So tennis elbows this way, golfer's elbows this side. So you're going to be able to tell straight away, yes, if it's golfer's elbow, it hurts, when I try and open a jar, hurts if somebody shakes my hand, hurts if I try and pick up a coffee, hurts if I try, and turn a key in the door. That sounds like it's tennis elbow. And then we'll show you a couple of tests, which is basically, can you resist having your arm pushed down? And if it hurts here, then it's most likely a tennis elbow. So then there'll be a little bit of information on, what's the best way to manage it, what's the time frames involved with tennis elbow, and what you need to look at doing. So in a nutshell, if you have something like tennis elbow, if it's quite early on, you need to be stretching it, you need to be resting it from aggravating activity. But once it's been there for a long, long time, you actually need to be strengthening it, but you need to be strengthening it in a good way. So it's worthwhile, or it's really necessary that you actually get that checked so that we know that there's no tears in there. We know that, we're actually managing it in a good way. And that's the purpose of the app. The app is there to give you a bit of information that if you think you've hurt your knee or you've rolled your ankle, what that would feel like. So we know straight away if somebody says, look, I've hurt my knee, it blew up straight away and it keeps giving way on me, then we're thinking, oh, a blown up knee, that means that there's some damage in the joint. If it keeps giving way, maybe you've damaged your cruciate ligaments, and we'd need to test that and check that. If somebody says, look, their knee is locking on them, then straight away we think, oh, it could be a cartilage, it could be this, it could be a problem with their meniscus, we need to check this. So we're very app and up on what we think an issue might be. We know as soon as you tell us, we're sort of honing in, going, okay, these are the possibilities, and then we test those different possibilities and go, yeah, that's clear, that's not quite right, and then we'll investigate that further. So I get it a lot of the time where, I've been on the pitch at the side of a rugby field and somebody's hurt themselves and they'll say, look, I don't know if they can play. Can you come up and can you have a quick look and see what you think? And it'll be, yep, they're fine. It's just going to sting for a little while. They've just had a bit of a knock. If they're not happy after the next 5-10 minutes, then keep them off. If it's, oh, it looks like, I can't test it, they're in so much pain and they can't stand and they can't wobble or they can't manage it, it'll be, look, let's put some ice on it, let's see it in 10-15 minutes when they've calmed down a little bit and they've got over that initial shock and also got over the initial pain. And sometimes when we look at it then 10-15 minutes later, it's quite different, and it's just been the whole shock of having a knock and a hit, and there's been no major damage at all, and they're quite happy to get back on the pitch. Sometimes we see people and we just go, yuck, that's something nasty, do not go back on at all. And if that doesn't settle, you need to get it looked at properly, or you know what, you need to go straight. You've done something bad there, or you've potentially done something nasty there. Keep it up, keep it elevated, keep some ice on it, keep it sort of contained, so we strap it and tape it for them so it's supported and they take themselves off to either A&E or ER, depending on where you are. So yeah, from our point of view, we know pretty quick. We've got a good idea of what things should feel like. We've got a good idea what things present like. We know some of the basic ligament tests and some of the things that we can do there and then. And if it's feeling okay, great. We know that there's been no major ligament damage, although you might be sore. You guys don't have that. You don't have that previous information. So if you have access to something like this program, and it basically is available like an online course where you can just log in and look it up, but it's also available in an app format through an app portal, so you can have it on your phone and reference it on your phone. Now what that means is if you have hurt your knee, for argument's sake, or you've rolled your ankle, there's a couple of things that you can say, like, does it hurt if you do this? Does it feel unstable if you do this? If you test it this way, what happens? And that should give you enough information to go, yep, I need to get that checked. And that's the purpose of it. I've known, a couple of people who I've seen and looked at and gone, yeah, that ankle's dodgy, that knee's dodgy. You've got some laxity in there. You really need to make sure that you have it strapped and taped if you're going to play. You really need to look after it because there's a bit of stress and the ligaments are what we call lax. It doesn't mean they're torn or ruptured, but it does mean there's a little bit more play in than is normal compared to your other side. And then finding out, further down the track that they haven't been doing that and they've ruptured their ligament and they've ended up in surgery. So, even though we might have that information and we impart that information, sometimes you guys don't know how serious it is. And sometimes people mollycoddle things that aren't serious. So the purpose of the My Physio or My Pocket Physio app or My Pocket Physio injury management program is to give you an insight into it. It's to give you some basics, give you some information to look at. So if you have hurt your knee and your knee just keeps giving way on you, you might be able to look at this and say, look, actually, if it's giving way and it's doing this and it feels this way, I should probably get it checked if it hasn't settled within a day or two. Or if you're there thinking, okay, my knee's locking and it's got stuck and I'm really having to force it, if you look it up and go, actually, it could be a cartilage tear, that's something you don't want to force, so don't force it. Take yourself to, the doctor or to emergency so that they can look at it, because if you force it, you can make the damage worse. So hence why My Pocket Physio was born, and at the moment we're doing pre-sale or pre-release, which is just basically meaning we're going to officially launch in December the 8th. So December the 8th it will be out there, and at the moment we have pre-launch for it. Just so we can put the finishing touches to it, and B, if people who purchase it in pre-sale have anything that they'd like to see on there, they can feel free to email, and obviously over the time we'll do updates. You will have lifetime access to it. So once it's up and once it's running, you'll get your own login, your own access, and you can obviously just get it on your phone, hence the name, My Pocket Physio. You can just have it there on your phone, quickly look it up and just go, yep, my knee, this is it. Does it feel like this? Yes, I might have done a cartilage damage, or actually it might be just a problem with some maltracking. I might just have some irritation behind my kneecap, or it might just be a tight ITB. So there'll be some of those basic things on there, just the most common injuries, problems, things that we get normal day in, day out. So what does a disc problem look like? What does sciatica look like? What does it look like, when you've done your cruciate ligament? What does it look like when you've done your cartilage or your meniscus? What does it look like if you have plantar fasciitis? What does it look like if you have a lateral ligament strain? What does it look like with tennis elbow, golfer's elbow, shoulder problems like rotator cuff? So some of the big things that generally people happen, acromioclavicular joints, if you've done that, what does it look like? Is there a small bump? Is there a big bump? Where's the pain? So you've got some good things that you can just go, it might be that. Do I need to get that investigated? And you can make a little bit more of an informed decision rather than going, hang on a minute, I'll just see how it is in a week or two, because a week or two down the track might be a week or two too late. So if you're interested, pre-week or pre-sale or pre-launch sale is on. It's just going to be $21. So like I said, it's aimed at really just trying to get you guys to have access to information that we just have in our heads. So it's just a case of getting it out of our heads and down so that you guys can access it. And then from there, like I say, it's not a management app. It's not going to tell you how to do it step 1, 2, 3 and 4 to do all your rehab and everything like that. What it is going to do is say, if you're having these symptoms, this is what you can do to test if this is the case, and a simple test that you might be able to do at home if it's applicable. And then from there, if that is positive or it is sort of displaying what we would expect, you can then take that information and go, okay, this is my initial stages of management. I shouldn't, put this into this position because it'll make it worse, or I shouldn't stand on my knee and twist because that will make it worse. I need to go and get it looked at and checked properly. So if you're interested, I'd love for you to have access to that information. Like I say, we're on pre-sale at the moment, so $21, and we launch on the 8th, Monday the 8th, I believe, of December is our launch date. If you do take us up on the offer and you do have something that you are interested in having covered, so if you know, I'd really like to know if I have a problem with my Achilles tendon, or my calf keeps cramping and I don't know what that is, you might want to just email and say, look, is this in, can we make sure this is included in it? Quite open to have things that people might like to have included in it, so that we have as big a resource as we can. Once you've got access to it, you have access for life, so it's just going to be a one-off payment, one-off access, and you have access to whatever's on there and whatever updates we do. So if you're interested, or you're keen and you think, I really need that, I'd like to have a physio head in my back pocket, then the My Pocket Physio program, which is your injury management tool, is going on pre-sale for now at just $21, and we'd love to have you on board. So click the link in the comments or click the tab below if you'd like some more info, or feel free, just flick me an email at info@corefusion.net.au if you've got any questions, and I'd love to help you out. So really excited to have this launching, really excited that we can get a little bit more help out there for people who just want to ask a question, or they just want to know, I think I've done my meniscus, or I think I've done my cartilage, or I think I've done my ACL. What does that present like? What does that feel like? Is that what I'm feeling here? And then at least you've got something a little bit more concrete to hang on to. Yes, you can maybe look it up on Google, but you're going to have all these things in one place where you can just go, yep, it doesn't sound like that, does it sound like this? And all the knee stuff will be all together, so you can just go through the different things and check out if that applies to you. So thanks for watching this far. My Pocket Physio coming on the 8th of December. Thanks.